Hello and welcome to another edition of In Good Shape, your health magazine here on DW from Berlin. Perhaps you suffer from back pain, or maybe a sore knee joint bothers you from time to time. So you go and see your doctor and he tells you that he can't find anything wrong with your back or your knees. If that's the case, perhaps you should take a look at your hip joint, as pain in the hip can radiate to the back and the knee. How to diagnose and treat hip pain is a topic we'll be looking at in depth today. And here's what else is on the show. Building muscle. How effective are power plates in fitness training? Important conditioning. What to do for dry and itchy skin. And stop stuttering. Techniques to overcome speech problems. Your hip is one of the biggest joints in your body and it's under a lot of strain. For example, if you walk for 5 kilometers, you put your weight onto the hip about 10,000 times. And it's not just your body weight. Due to the angle between your leg and the pelvis, the strain on the hip joint can equal up to 300 kilos. Imagine what this means for your hips over the course of a lifetime. So no wonder that the hips can deteriorate and become very painful.
Thomas Günther is a surveyor, but it became difficult for him to do his job due to pain, particularly in his left knee.
I could hardly bend my knees. My thighs hurt too. I had a history of back problems, so I thought my discs were acting up again.
His freedom of movement continued to diminish until he could hardly work or do sports.
I woke up one morning and thought, what's going on? From one day to the next, you can't move. Yesterday I could have run a half a marathon, and today I can't do anything at all.
His doctor suspected a slipped disc, which can shoot pain down into the knees. But no prolapsed discs could be seen on the x-rays. An orthopedist prescribed physical therapy for his knees.
It didn't get any better. In fact, it just got worse. It was hard to take.
So he went to a specialized clinic. Orthopedist Bertram Regenbrecht saw straight away that what hurt most was when Günther bent his leg while turning it inward or outward. That was an essential clue. The doctor suspected the pain originated in the hip joint and decided to perform a further examination. The doctor's suspicion proved right. He discovered clear signs of frayed cartilage caused by a deformity of the hip joint socket. That prevented the ball and socket joint from moving freely. The diagnosis was impingement syndrome. A bone deformity, either congenital or resulting from an accident, inhibits the ball from fitting optimally into the socket. With every movement, the deformity scrapes against the cartilage, which becomes frayed and eventually inflamed, damaging the joint. The pain can travel through the nerves upward into the spine or to the groin and downward as far as the knees.
If we can make the diagnosis early on, in some cases we can largely relieve the patient's symptoms by modifying the pressure put on the joint, for instance, by changing the physical activities away from football or kickboxing. Sometimes you can substitute another kind of sport. Physical therapy plays a key part in relieving most of the symptoms, and it may even eliminate the need for an operation.
Should an operation prove unavoidable, one of several methods can be used: an open incision or several tiny ones. The surgeon can reshape bones, removing the mechanical problem that impairs the free movement of the ball in the hip joint socket. Damaged areas may be cut away entirely during the operation.
The earlier that impingement syndrome or a damaged hip is diagnosed, the better the chances of keeping the natural hip joint intact.
In Thomas Günther's case, the correct diagnosis came too late. His hip joint had already suffered too much damage. The only option was to put in an artificial joint. But it did the trick. Now Thomas Günther can work and move freely again without pain.
Joining me now in the studio to talk more about joint pain is Dr. Josef Zacher. He's an orthopedic surgeon and a hip specialist from the Helios Clinic here in Berlin. Welcome, Dr. Zacher, to the show.
Hello.
Let's first talk about the impingement syndrome or chronic pain of the tendons in the hip. Could you just summarize how does this occur?
Cam impingement occurs because there is an abnormal deformity of the hip joint causing pain and damage during internal rotation at this point of the hip joint. And this causes pain, and this may irradiate down to the knee even.
Okay, and this movement, which is causing pain, is like kicking a ball.
Yeah, it's absolutely, and these are the type of patients having this disease. It's young male athletes, especially if they have heavy muscles.
And one interesting fact is that the patient in the report was complaining about knee pain and back pain and not about real pain in the hip. And you just said that the pain can radiate. Is this a common problem?
It's very common because the nerves of the hip joint also are responsible for the knee joint. And by this way, the situation in the hip joint can cause a referred pain also in the knee joint. And as the patients don't move exactly as they should in the hip joint, this can also cause pain in the spine region.
And when talking about the treatment of impingement syndrome, I mean, this is an anatomical problem. So, I mean, pills don't help a lot?
In the beginning, you can take pills, you can take any conservative measures, but as it is an abnormal pathology at the bone, you have to treat at the end the joint by surgery.
And who defines the end when you need to treat it? Is it the patient or the doctor who says, no, you need to?
They usually are both, and at the end, the pain decides the time when you are going to do surgery. If conservative treatment isn't enough and the pain is really disturbing the patient and the life quality, then the time point of surgery has arrived.
And there are different forms of surgery. One is the keyhole surgery, it means a minimal approach and with very small scars. And the other one is wide open surgery. Which one would you prefer?
I'm a scientific man, so I would look for clinical trials. And in clinical trials, there is no real difference between these two types of surgeries. I just would recommend any patient, if you think about arthroscopic surgery, then really go to specialized centers which are really experienced in hip arthroscopy.
We got a viewer question from Canada. Helen Jäger wrote in to say that her daughter suffers from hip dysplasia and some kind of impingement syndrome. So could you just outline what hip dysplasia is?
This is a development disease of the hip joint, and the hip joint is not normal. And this may cause pain and also the impingement syndrome. And if you want to correct the deformity, you have to do a real big surgery, cutting the bone of the pelvis on 3 parts, reorientate the acetabular cup, and then do a fixation of the bone again. This means, yes, it's a big surgery.
And surgery is the only option in hip dysplasia to treat it?
As it is a pathologic situation of the bone on the hip joint, you have to correct it by cutting the bone and reorientate it. So that's the only possibility to correct the deformity.
Okay, thank you, Dr. Zacher, but don't go away. We come back to you after the next report. Did you know that impingement syndrome can lead to osteoarthritis? That's a progressive disorder of the joints caused by the gradual loss of cartilage. To get a better idea of this, let's take a closer look at the anatomy of the hip joint.
Joints take lots of punishment day in and day out. How do they do it? After the knees, our hip joints are the body's second largest joints. They're located between the femoral neck and the hip bone. The femur ends in a rounded head called the femoral ball. This ball fits into a socket in the pelvis called the acetabulum. To keep the bones from scraping against each other and to absorb shocks, the ball and socket are coated with a layer of cartilage. When the cartilage erodes, it frays or tears away completely. This is osteoarthritis. To keep the cartilage healthy, the body has to supply it with nutrients. The cartilage itself has no blood vessels to carry them. The joint is encased in the articular capsule, which produces synovial fluid in response to movement. This nourishes the cartilage. joints are also surrounded by muscles and ligaments, all in all a very resilient support system. The strongest ligaments have a tensile strength of up to 350 kilograms. Healthy joints can last a lifetime, but wear and tear, inflammation and accidents can take their toll and restrict movement.
Dr. Zacher, back to you now. With osteoarthritis, what are the typical symptoms?
The typical symptom of osteoarthritis is pain and loss of function. Pain is a pain typically in the groin region going down to the knee.
Mm-hmm. And then what's the cause of it?
The cause is at the end inflammation coming from the degradation of the cartilage.
Mm-hmm. And what role does being overweight play in this setting?
Obesity means more load to the joint, and if the joint is already distracted by osteoarthritis, this overload may cause even more inflammation.
Mm-hmm. So losing weight would be a great idea for patients with osteoarthritis.
We have good clinical trials demonstrating that losing weight also improves the symptoms, and patients do better with lower weight.
Mm-hmm. So when patients come into my surgery with osteoarthritis of the hip, and I usually recommend that they should do some exercise to lose weight, and it's good for the hip. But they say, oh, I'm very worried that the osteoarthritis gets worse when I'm moving around. Is that right?
The art is to do movement without overloading the joint. This means also do your exercises in the water or laying down and do the movements.
And is it all patients can do for the treatment of osteoarthritis, or there's some herbal drugs they could take? Or?
Yeah, at the end, you need, if you really want to treat pain, you need real painkillers, mostly that you can really diminish the pain for the patients.
And when should patients actually consider hip replacement surgery?
There is no real accepted algorithm of when to treat a hip by artificial joint replacement, but at the end it's the loss of quality of life, the cause of the disease, osteoarthritis, and the patient complaining, and conservative treatment hasn't been enough and good enough for the patient to relieve pain.
We got a viewer from Armenia, Samuel Levon, and he wrote in and said that he's in his mid-40s, he's 45 actually, and his doctors recommended an artificial hip for him, and because he's in lots of pain in his hip joint, and he now wants to know how long does a hip replacement last, because he's very young.
The correct answer is for hip replacement that there has to be some revision surgery in about 0.5 up to 1% of the patient per year.
And revision surgery means getting out the artificial hip and getting new.
Change it. Yeah. Mm-hmm. And this means that after 10 years, about 90 to 95% of the patients still have their original artificial hip working.
So it's okay for him, even in the young age of 45, to go for a hip replacement?
At the end, he has no other chance, because if he wants to get rid of his pain, he needs his artificial joint.
Mm-hmm. Our viewer, Wendy Lippiat from Australia, has had problems with her hips due to a slipped disc in her back. I think it radiated to the hip. And she now wants to know what kind of exercises she can do to make her hips and her pelvic more stable.
It's always training. I would use really walking, just walking on a flat surface, and do a lot of this kind of training. And also swimming, walking around in the water would be the best training for this kind of disease.
So get out and do some exercise. The best medicine, like always. Thanks, Dr. Zacher, for being with us in the studio. Thank you.